Since the establishment of the National Health Insurance Authority, NHIA, in 1997, its chief executive officers were appointed by the president. However, history was made with the appointment of Dr. Kelechi Ohiri. For the first time, its helmsman had to scale the litmus test of a Senate confirmation hearing. Section 40 of the NHIA Act, signed into law on May 19, 2022, requires that the president's nominee would satisfy the legislature, who essentially are representatives of the people, before being confirmed on the job. Dr. Ohiri was named as the Chief Executive Officer of NHIA on October 20, 2023, as the second Director General of the agency. He appeared before the Senate Committee on Health on February 20, 2024. Exuding unassailable confidence, Dr. Ohiri fielded questions from the Senator Dr. Banigo Ibalibo-led committee on issues bordering on expansion of health insurance in Nigeria.
Now, we know that the awareness for health insurance in Nigeria is quite low. So I would like to know from you how you propose to get the exact numbers of persons that are covered by health insurance, both in the formal and informal sectors in Nigeria.
Indeed, there is low awareness of health insurance as a veritable tool for financial protection. Some of it is cultural, but also some of it is more work and effort that is needed on our part to educate fellow Nigerians on this. We have about 70% of Nigerians who still pay for care out of pocket and privately. And this means that they are vulnerable to the shocks, they are vulnerable to the prices of rising costs of healthcare. Bringing a lot of these people under the umbrella of health insurance will also enable us to actually increase coverage. But then there are those of us that don't have the pockets to pay the premiums that are required for insurance. And this is where interventions come in, such as the Basic Healthcare Provision Fund, and recently, the Vulnerable Fund, for which we are extremely grateful for the first time making this provision in the budget.
While the committee acknowledged the competence of the Ivy League trained helmsman, it sought to know how he would expand health insurance coverage to every Nigerian.
Can you share with us what you intend to do to really double this registration in the next few years?
Over the last couple of months, I have been listening and engaging with multiple stakeholders, both at the states, my colleagues at the state health insurance schemes, and I'm proud to say that almost every state in Nigeria now has a state social health insurance scheme. And that's a testament to the commitment of our governors in actually expanding health insurance coverage. There are 4 goals that we have set up, or strategic objectives. Having listened to many stakeholders, also listening to the staff within the NHIA who have worked on several of these programs. The first is the coverage mandate, which, as mentioned, the objective is to have more Nigerians come under this umbrella. The second is the equity imperative, which is the fact that we can't wait until the wealthy have got coverage before we think of the poor. So being armed with the tools of the Basic Healthcare Provision Fund, the Vulnerable Group Fund, and other equity interventions, we ensure that this health insurance coverage reaches all Nigerians, especially those who do not have.
Dr. Ohiri is the 13th Chief Executive Officer of the agency, and he brings a kaleidoscope of international experience to the job.